Welcome to your first week of clinical calculations. In the next 10 weeks, you will develop the skills and tools necessary to administer drugs safely to each of your patients. This week, we will identify components of a drug label as well as components of medication orders. Both are critically important to you as a nurse. So let's look at some drug labels. The large letters at the top are the commercial or brand name. The small letters are the generic or chemical name. The dosage, 120 milligrams. They're in capsules. Expiration date, lot number, pharmaceutical company. So here's another drug label for us to look at. This is succinylcholine. It's a critical care medication and is used for intubation. But it's a little bit different. Your brand name is down here and it's in small letters this time. You can see the trademark. The generic name is succinylcholine. The dosage is 200 milligrams. It's in a 10 ml vial, and this equates to 20 milligrams per ml. The lot number you'll find over here, as well as the expiration date that's right next to it. It's an IV or IM use only. The pharmaceutical company. And then additionally, you should look at this little section here, and it tells you it needs to be stored at 2 to 8 Celsius, which is refrigerated. A little bit about this drug. As I mentioned, it is a critical care medication. It's used for intubation. Many facilities do not allow nurses to push this medication, but you are required to draw it up into a vial and give it to your doctor as he has ordered it. So, you need to be able to read the label, to draw up the medication that he requires you to draw up, to confirm it with him, and to give him the right amount of medication. He is expecting to get what he orders, and it is your responsibility to do so. Medication orders have 6 components that are absolutely necessary. If those 6 components are not there, then it is your responsibility as a nurse to take the order back to your doctor and have the order clarified. You cannot give a medication unless you have a properly written order. So each order requires you to have a date and time. You need a drug name, heparin, morphine, penicillin, how much of the medication the doctor wants you to give to the patient, how he wants you to give it, whether it's IV, IM, PO, how often that medication should be given, and it requires a healthcare provider signature, whether it be a doctor's signature, it can be an OD, it can be an FNP. It requires the healthcare provider signature at all times. So let's take a look at a couple of med orders and look at the components necessary and how they should be written. First of all, you should have a date, a time, and the time should be in military time, the name of the drug, how much of the drug you're supposed to give, and I want you to note here that it's a 0.25. You have to have a 0 in front of the decimal point if it is less than 1. The route that it's being given and how often the medication is going to be given, and then you have your physician's signature as we discussed. So now that we've looked at what is required in a drug order, let's take a look at this and see if we can tell what's missing. So we have a date. We're missing the time that it was ordered. We have a drug name. We have a dosage, it's 30 milligrams. We have a route, it's PO. We have a PRN. PRN is give it as necessary. The problem with a PRN order is that it requires parameters, and those parameters have to be how often we're going to give the medication, and it requires what for, such as PRN Q6 hours for pain. In the case of Tylenol, Q8 hours PRN for fever of 101. Absolutely necessary to have parameters. We have a healthcare signature. So what are you going to do with this order? You're going to go back to your physician who wrote the order, and you're going to ask him to please clarify it so that you can give the medication. Because as written, it is not a correctly written prescription, and you can therefore cannot give it to your patient. Okay, take a couple of moments, look at the prescription here, and let's see if you can identify what is missing. Okay, well, we know we have a date. Looks good. We have a time. We have a drug name. There is no healthcare signature. Anybody could have written this prescription. We have a dosage, it's 5 milligrams. We have no route. I don't know if it's IM, IV, PO, and frequency. Again, we have the PRN order. And again, you need parameters when you have this PRN order. Should I give morphine IV every hour, every 15 minutes, every 20 minutes? Absolutely necessary. So once again, this order needs to go back to the physician that wrote it, and it needs to be clarified. Well, that completes the tutorial for this week. In your clinical calculation book, you'll find plenty of practice examples, both for med orders and for labels. Next week, at the beginning of the week, you will have a short quiz that covers this material. Please, if you have any questions, contact me. It is critical that you learn this information and that you understand it. And next week we're going to work on abbreviations, so if you get a chance, please review the section for next week. And I hope you have a good week. And again, please contact me for any questions that you might have concerning the material that you were assigned for this week.